Hello, good afternoon, everyone, and welcome to today's Care Connection webinar. My name is Laurel Gumpert, and I'm the Educational Program Coordinator here at the Alzheimer's Foundation of America, and I'm thrilled for you all to be joining us today. We have been here at AFA, been excited about this webinar for several months now, ever since I spoke with Anita, I think it was maybe 6 months ago. I've been excited about this. So very happy to have you all here today. And we're going to be talking about dementia, dental care, and of course, the very special donkeys. So before we get started, I just want to let you all know that all lines are currently muted. However, we do encourage questions. So you should be able to see on the right-hand side of your screen a question box. So please feel free to utilize that, and you can type in any questions that you may have, or you can just say hi, and we will have time for questions at the end. If you have anything that we don't get to, I'll put in the chat AFA's helpline number, which is staffed with all licensed social workers 7 days a week, 12 hours a day, 9 a.m. to 9 p.m. Eastern time. So with that, let's get to the good stuff. I'd like to introduce our guest speaker today, Anita Siddall. She is CEO and founder of Toothbrushers and Balaam donkeys. Donkey, having worked as both a CNA in a long-term care centers and also as a dental hygienist, Anita experienced firsthand the difficulty of providing adequate daily oral care to people who are unable to care for their own mouth. And in the busy environment of long-term care centers, she certainly found a need. Another obstacle to adequate daily oral care is the fact that removing oral plaque in the presence of oral disease requires special tools, training, and a whole lot of time. So with current research uncovering more and more dire connections between oral disease and declining systemic health, it was important for Anita to take action. So Anita started Toothbrushers and Balaam Donkey. And with that, I'd like her to tell you a little bit more about it. So Anita, please take it away.
Thank you, Laurel, and thank you for anybody that's here. I really feel honored to be among people that I see as truly the finest people in America. If you're someone that has committed yourself to caring for others, I just don't think that there's a better person anywhere. So I am truly honored to be in your presence. Yeah, I am a dental hygienist, and I've been a dental hygienist for 37 years. And they let kindergartners do it back then, obviously. And clearly, Toothbrushers and Balaam's donkey is, if not the goofiest name, certainly up for the goofiest named corporation ever, but that's who we are. And I started this business, Laurel said it so well, I don't think I've got a lot more to say about it. We started it because I have a partner now that she's also a hygienist, and we started it because we see that anyone who needs personal care is in need of a dental toothbrushing provider. They have disease and they need specialized care. But the thing that we discovered is that there was another really very important ingredient in order to be able to provide our care at the level that we wanted to provide it. So let's go to the next slide. So guess what? What do you think is extremely important in a toothbrushing ministry? And again, Laurel, I need a button. And you can go again, Laurel. Just says what's important. You probably thought of things like dental tools and training and extra time and specialized care, and all of that was right. But we found that we really, really needed a donkey. And this guy's named Jack, and he's a real donkey, and he's part of our family. He got dropped into our life kind of as a skinny, debilitated, nearly starved donkey, and now he's part of our ministry. So go ahead. He's not alone in what he provides. We also need a dog, a cowboy, and a mule. We've got a few mules, and they take turns coming and helping us with what we do. And their job is, go ahead, Laura, is to spread joy and more. And believe it or not, it's not just a warm fuzzy. We've actually learned that it's really important. So let's go to the next slide. So this is Larry. Larry is one of our clients, and we were told that he was a loner, that he can be resistant to care, that he can even be aggressive, kind of combative if people try to touch him, or if they, for lots of different reasons, but he could have been a little bit of troublemaker, so we were told. But he absolutely fell in love with our furry friends. And go ahead, Laurel, you can go to the next part. Jack and our animals really did break through. Actually, on this day, it was a bittersweet day because as we actually left their yard, they have a big, beautiful garden yard and big gates and fences around it. And as we had to bring the animals out of the yard, he actually followed and had tears in his eyes. And he even tried to climb the fence to come after us. And he was calling to us and didn't want us to leave. So that was a bittersweet thing. But he is just one of the people that are our clients that we recognized that are just emotionally kind of are having some struggles. And another one of our clients, Patty, when we first started with her, she had matted, unkept hair. And the day I saw her, she had her PJs on, and because she wouldn't let them put her clothes on, and she was kind of grouchy and kind of had a scowl on her face. And when we attempted to mess with her, there would be none of it. I mean, she just was not an easy person to break through with. Another one of our clients that also struggled was Doris. She was very depressed. We found her hiding under her covers and sometimes in her closet, and she'd be mad at the staff and mad at people and depressed and just wanted to go home. So that was her, that was Doris when we first met her. And then a very different but kind of equally struggling person was Ruth. Ruth was, I found her sitting in a chair, sort of staring off into nothingness, and she didn't even notice when I showed up. And she was completely listless, completely unaware that I was in her presence. And when I even touched and tried to start doing things with her mouth, it was as if she didn't even know I was there. She didn't open her teeth or allow help at all. And I actually found unchewed food, like complete identifiable toast and food in her, between her cheeks and her teeth. And so yeah, all of these people were just some examples of people that they just really were struggling with stuff other than just dental things. You can turn the slide. So what we learned is that it was extremely important that we need to enter the heart of our client before we're allowed to enter their personal space. And we have to remember that this personal space, their mouth, is probably tender. It's likely infected. And so often when you have an area that you're not comfortable with, you don't want someone in it. And so they're resistant. They don't want people in that private space. So it really did take something more than what I'm used to. You know, people come to my office and they know what they're there for, and I clean their teeth because that's what we're here to do. Well, this was a different situation, and we had to figure out some new ways to do things. So let's move to the next thing. We actually added a helper to our plan. So we knew we needed an oral care aide that was professionally trained. They became certified. They knew oral anatomy, infection control, and how to use the tools to adequately and excellently remove plaque. But we knew that we needed someone more. And so we actually added other people that were kind of an assistant, and they were all focused on the emotional side. And now we have absolute intentional emotional therapy as part of our daily provision of care. And as you can see, we love before we lead. So we became very popular, and we had people clinging onto us and following us around. And so yeah, this was a big change, very, very big change. And so we use the animals to not only spread joy, but they also help us to open up people's minds to what we're doing and listen to what we're trying to do. And then they also make these guys warm, but they also are our models of love and affection and warmth that we intentionally share with our people. So that you can turn the page. Oop. Okay, go ahead to that one. All right. So this is our animals. That's a different mule. That's not our donkey. That's a mule. And she's, her name is Esther, and she was there that day. Spreading joy is because we know that overall wellness is bigger than just the mouth. We care about it all. And the animals are fun. They allow us to reach more groups, explain our mission, increase our number of smiles. But we also knew that what they taught us was that we want to think like them and be like them, that touching people had to be part of our intention. Go ahead to the next slide. So with each one of our oral care aides and our volunteers, everyone that comes through our training, they learn that it is super important that every single client, every single time, we are intentionally making sure that each of our clients feel seen, and they also heard and valued, chosen, and respected. And those are drilled into our people's head, that our clients need to believe that every single one of these is true about themselves. And that is a daily mission every single time that we see them. Those things are our goal. Go ahead. This is Linda, and another one of our clients, and she wasn't having a very good day today. We could have been where we just rushed up into her space and said, come on, we need to take care of your teeth. And unfortunately, we often saw, because the staff at care centers, we realize they are great people doing a lot of fantastic things. They're highly trained, but they've got a lot on their plate, and they're doing a lot. And we saw that they often were kind of busy. And so when they would go up to clients and the residents, they often had sort of an agenda, something in mind, and that agenda was often one of the first things that was thrown at the person. So they would often be like, come on, honey, we've got to get on the bus, or let's go to breakfast now. Come on, sweetie, I know. And if the resident had questions or were confused or they were concerned, it was common to see a little bit of mitigation of that. Like, yeah, I know, we'll talk about that later, but right now we have to do and fill in the blank. It might be breakfast or lunch, or they're taking a trip, or they've got to go somewhere. And so they got very used to and almost resistant to people coming up to them, because they just assumed that you had some agenda for them. So we tried to do things differently. We tried to take on a different approach that really was all about them. So we'll come back to Linda. Let's go on to let's talk about teeth for a minute. Here's something you guys can get involved with. What percentage of people with moderate to advanced Alzheimer's disease have oral disease? Okay, so if they have Alzheimer's, do they also have oral disease? Thoughts, and what percentage if so?
So you all can just put this in the question box. Let us know what you're thinking. Any guesses, any percentages? You can just type it in and then we can see. So you can just type it right into the question box.
Got any brave souls out there?
I see here someone said 90%. Someone said 45. Oh my goodness, so many. Oh goodness. So many. 90, all of them. 150, 35, 60,
Hi.
98. Okay, great job, everybody. I love
Right.
this.
Let's turn the slide. 100%. I bet nobody was brave enough to say that, right? And now I bet there's people out there saying, wait, you haven't been to my house, you haven't been to my state, you haven't been to my city, you don't know if everybody that has Alzheimer's, moderate to advanced Alzheimer's has disease. You certainly don't know. Yes, I do. And the reason I know is, like I said, I've had 37 years in the world that I live in, and this is what I've learned. So when people come to our office, first of all, I don't know who guessed 40 to 45%, but that would probably be Americans. If I said how many Americans have oral disease, the 40 to 45% would be more accurate. So when people come into our office, they at least, a lot of them have at least the beginnings of imperfections. They might have gingivitis, they might have some decalcified teeth, that are a little bit more likely to have decay, but none of those are really big problems because they know how to brush their teeth, floss, they're using toothpaste, they're going into the dentist, they're taking care of things. And so those light beginnings, those beginnings of oral disease aren't a huge problem in their mouth. But this is what happens. When we see people of any level that need personal help, personal assistance, we quickly see a change in their mouth. We see that little bit of disease ramps up, okay? And then if we have people that actually have been diagnosed with Alzheimer's, maybe they're still at home alone, or maybe they just need a little help. Maybe they're getting lost when they're driving places, they're losing stuff, they're forgetting stuff, they need a little financial help. These people, their periodontal disease jumps a lot. And the reason, I believe, is because just like the rest of their life, things are getting less consistent. They're getting less accurate. So they might forget sometimes, or they might not complete the task, or their dexterity has messed up, or they're not as thorough, or there's a bunch of different reasons, but we definitely see that light problem increases when things just barely start. It jumps again when the diagnosis has happened. And then by the time they're actually needing full-time care, where they may have a family member, or perhaps they're living in a facility, 100%, absolutely. The disease, it just grows so fast and so exponential. If you want to be wowed, and actually in a very sad way, take a look, research, just Google anything, how long it takes for the bugs in our mouth, the bacteria, to change from what you and I have, which would be gram-positive organisms, which are not great, but they aren't horrible, to gram-negative. It's like 3 days or 4 days. Well, how many of these people have gone 3 days in at least one area of their mouth that hasn't been disturbed? That plaque is still sitting there. All of them. So 100%, and it goes very quickly, and it gets bad very quickly. So 100%, 100% is the answer. And why does it matter? The reason it matters is because our mouth is part of our body, and infections in our body are dangerous. That's why we have antibiotics. That's why we go to the doctor. And so it matters. And it matters all through our body. I went to a state meeting, which is a national Iowa State Dental Convention, and what was said there was that 98, and this is my memory, so it might not be perfect, but 98% of oral or of systemic disease is manifested at the mouth. And wow, that's a big deal. And if you look at the other way, when we have disease in our mouth, it's been absolutely proven to affect heart disease, diabetes, low birth weight babies, our organs, even like Crohn's disease, and gosh, it's endless. Something though that it increases the risk of strokes too. But something that we see all the time is people with diabetes, when their blood sugar just is really struggling to be under control, almost always their periodontal disease has exacerbated. Now, you can ask which came first, the chicken or the egg, and I would say that the two of them are so closely linked that probably one exacerbates the other, as does. So if you're not taking good care of your mouth, your blood sugar is going to struggle. But if you're really out of whack with your blood sugar, your periodontal disease is going to struggle too. So those two are like really twin brothers. So you really want to be careful of your mouth if you're a diabetic. Okay, we'll move on. That's as much boring Anita talk as you want. So we'll get back to my sweet friend, Linda. So this picture is a great one. This day, that person right there is Heidi, and she's one of our oral care aides. And boy, she was born a donkey. I'm not kidding you. She's just got the biggest heart that anyone could ever have. And something that we sort of accidentally fell into, again, I know mouths, but I have to say that as we've grown and learned about the emotional support and the donkey time, is that it's just bigger. And so one of the times that I wasn't there, as our oral care aides were providing daily care, they told me that there was a person that was really struggling, and she was actually tearful that day. She had just been wandering through the facility crying and having a bad day. And they didn't know whether they'd be able to care for her mouth because she just was pretty upset that day. And so the oral care aide just decided to sit with her and said, how about if I get you a glass of water and we just visit? And she got her a glass of water, and that person, our client, just started guzzling the water. So they got more and more and more. She ended up drinking like 3 glasses of water. She started to cry less, and they were able to care for her mouth. Well, we all start talking, and one of the things that we have seen in all of our clients was that they're very dry. Their mouth is very dry. Many of them had very dry red eyes and crusty around their eyes. And so we started to assume that maybe dehydration was happening, that it was a problem. And, you know, even though we did not do medical tests to decide whether they were dehydrated, we just took it upon ourselves that we started giving them all a drink of water before all of our care, kind of as that emotional, just having fellowship, sharing something with someone when you're sitting there and letting them have a drink. It's just kind of a pleasant time. But we also knew that if dehydration was a problem, this would be helping that. And we did find out that dehydration does cause dry mouth, or it exacerbates it. And then look at this, it causes dizziness, hallucinations, and rapid heartbeat, all of which are very common problems in Alzheimer's. Alzheimer's people fall a lot more. If you look at Linda there, she actually has bruises still on her face, under that eye and on her cheek. She had fallen a few days before that, and she broke a tooth too. So we were making a strong attempt to get them hydrated. Well, my beautiful oral care aide, Heidi, she took it upon herself, and she made these glasses, and each of the glasses are a different color, and they change color when you put water in them, so we can always tell whether they're full. And their lids are tight so they don't tip over, and they have a straw, and she customized them. She actually, we knew our clients so well that we were able to do specialized things on their cup, that so they had their name and then they had stuff that mattered. So like Linda's there, she loved cats, so that had little kitty pictures and cats on it. And that's the day that Heidi gave Linda her cup, and it went over very, very well. You can turn this slide, Laurel. Okay. So these are a couple other people in the cups. You can see there's a purple one. Her favorite color was purple. She wore purple all the time. So of course we had to find her a purple cup and to match like most of her outfits. And then Tony's the big guy there. He's an athlete. And so he always is talking about sports. So his cup was blue. We had his jersey number on his cup and his name on his cup, and then sports stuff on his cup. And then the other cup is Linda's cup with the little kitties on there. But every client got their own cup. They got their name on their cup and stuff that they liked, so they could keep hydrated. And we actually let them have the cups, and they have them all day long, so the staff can even keep them filled up. And it's been a really, really good thing. You can turn the page. All right, new story. This is Francis. So this is a guy that was not our client, but the nurse practitioner was there that day doing physicals, medical exams, and she approached us and said that when she had done her examination on Francis, he had mentioned that his mouth was hurting. So she asked us, she said, I looked in his mouth, I didn't really see anything going wrong, I don't know, so can you guys go and take a look? And I was there that day, and so we said sure. And so we went in there. This is the very day, the moment that we saw him, we took this photograph. Now, if you can see his mouth, there is a broken tooth at the back there, and that was part of the pain, I'm sure. But this stuff that's around his teeth, I bet you're kind of looking at that and you're thinking that maybe it's food. Nope, it's not food. It is plaque. So the difference between food and plaque is quite a lot, actually. Plaque is actually full of organisms, and they are growing all the time in our mouth. And food is like toast and eggs and stuff like that. So plaque is way worse. And so what we're seeing there is very, very, very thick plaque. And we decided we really can't do an evaluation. Like, I can't even look and see if there's a problem. I mean, obviously I saw a broken tooth, but I can't see much else. So I grabbed some gauze and got it moist, and I tried to wipe off what I saw, but it was so dry and thick that gauze wouldn't do it, toothbrush wouldn't do it. So we just brought in our tools, and you can turn the page, Laurel. Next slide. All right, so here's the tools that we use on every single one of our people. And so we brought these in for Francis. And what's on that tray, if you can take a look on the tray, we have little cup of antimicrobial solution that has fluoride. It's on the lower left corner. It's just a little tiny cup. I also have some here. So that's part of the plan. And then we have gauze to apply that. If you don't have gauze though, a washcloth works fine. A soft pick, it is a beautifully wonderful, my favorite tool, worthy of shopping for. These things are little glorified toothpicks. They're soft, they have little rubber knobbies on them, and they're fantastic. They take gunk off, and yet they're gentle. This is so they made by the gum company, worthy of shopping. So do that. Okay, so, and then we have a power toothbrush, and a power toothbrush really is the way to go. You can get a super soft brush head, which is what we do, but a power toothbrush you can gently place on the tooth and gum and let it do all of the work. It just gently agitates and gets the bad stuff off. When you use a manual toothbrush, you have to scrape and scrub, and you can just do a lot of tissue damage. They don't do nearly as thorough of a job, not even close to as good. So power toothbrush is the way to go. And then we have floss and a mirror. Of course, if you're at home and you're caring for someone at home and you want to do these things, you can do this. You don't need to go and order a whole bunch of disposable mirrors like we use. You can use a spoon. That's what we do. Well, we don't, but you can. You can use a spoon. It'll help reflect the flashlight to do a good oral screening, and it also deflects the cheek and the tongue to look in the mouth. So spoon is your friend. You can use that. And then a flashlight. That's how we check everything well and look into that dark place. We can go to the next thing. So let me show you quick how we cared for our clients. None of my clients wanted to, volunteer for this. So this dude is gonna be the guy that gets his tooth cared for today. So the first thing we do is wash your hands, and then you want to put on gloves. Now, if you're caring for a loved one and you're comfortable with just your clean hands going into their mouth, you do you. But of course, we always wash our hands well, and then we put on gloves. Then we take gauze, and you can take a washcloth if you don't have gauze. And we're going to use our antimicrobial solution. Now, this is not what we use. We use a prescription kind of level, but this is good stuff. It's got fluoride, it kills germs. So you can buy this. It's good. It doesn't have alcohol. You don't want alcohol. With the dry mouth, alcohol dries things more. No alcohol. This is a good one. So that's what I have here today. And you're going to get your gauze wet, because when you've got a dry mouth and stuck on stuff, this is very important. So I have wet gauze, and I'm going to go inside the mouth, and I'm going to actually wipe out all the food that's caught between the cheeks and the lips very gently. Now remember, the donkey time has to come first. You've got to get a relationship. You've got to have love, respect, kindness first. And you might think if your family, that's already taken care of. It might not be. And I say that because if you haven't been doing this space, this is pretty personal, and you may or may not be able to get everything done on day one. So take your time, be super gentle. Remember that there's probably pain because they probably have infection. They do have infection, and they're going to be sore. So gentle, gentle, gentle. So we wipe gently everywhere, and we're getting out bad stuff, and we're also adding that good stuff to the teeth and gums, okay? So we're rubbing it everywhere. After we do that, then we're gonna take my favorite tool, my little saw pick. Now, we train our oral care aides to do everything in the exact same order. So I don't know which way to go. Okay, so we always start on the upper right of the mouth, and we teach them with the soft pick to actually trace and rub under the gum line and around each tooth, and then in between each tooth. So they trace every tooth. That plaque is dry, it's really sticky, it's hard to get off, and you have to be intentional about every single tooth. So they go around every single tooth very well, very thoroughly. You have to clean even what you can't see. Organisms are microscopic. The stuff you're seeing, it means there's millions of them. There's even stuff you can't see. So you have to rub every surface very thoroughly. We do the outside, the same on the inside, the bottom, and the same on the inside. So after we're done with our soft pick, and the whole while we're dipping it into our solution. So you keep it moist and you keep rubbing all over the place. That helps get the plaque off, it helps kill germs, and it helps add fluoride to the surface of the tooth. Dip and use, all right? After that, then we get our toothbrush. Now, this toothbrush looks a little goofy, as you can see, because it's got a goofy bag on it. Yeah, we disinfect all of our tools, but then we actually put them into a baggie, and this baggie acts as a barrier. So when my hands get full of the germs from my client, I'm not going to put those germs onto my tool. So that's why I have my baggie. You can just use a baggie that you have at home. And then again, our oral care aides are taught to do everything exactly the same. The reason is because not only do we make sure they're very thorough, but we also, the clientele tend to cooperate and enjoy and feel better about something that's predictable. So you'll be able to move along and they know what to expect. They know how long it takes and they kind of start to feel more comfortable. And we have found that we get further and further and further when we do things the same way. So I do encourage that you do a methodical, organized plan. So we dip our toothbrush into our solution. I don't know if you can see this, but I'm dipping it into my solution. And then I'm placing it at between the tooth and the gum, and I'm letting the brush sit on the tooth and letting it do the work. All right. And I have to sit there about 3 seconds on each tooth. That 3 seconds is assuming this mouth has been cleaned on a regular basis. If this is that Francis mouth that is dry and thick and it's been there a long time and you really have to break through, it might take longer than 3 seconds. You'll have to kind of watch and see. But remember, with brand new tissue, people that haven't had this care, you might not be able to turn the power on right away. You might have to do it just by rubbing and gently circling very softly and doing as much as they'll allow each time, getting more thorough until you can provide all the care. So you're going to go on every single tooth, those 3 seconds, and of course, then on the back of each tooth, and the same with the bottom. And then depending on the person, if they allow you to brush their tongue, that's a really good idea. It reduces bacteria in the mouth. They may not allow that. Some of them also handle the washcloth or the gauze on their tongue better. So if you're able to reduce the bacteria, that's a good idea. So after we brush with our solution, then we floss. And floss is important. For those people that live in this icy state, you guys know what it's like to get ice on your windshield. Well, I always say that the snow is like food. You can brush that off, but ice needs to be scraped. And plaque is like that ice. It needs to be scraped. So you're gonna wrap your floss not on your first fingers, but on your middle fingers, all right? That way you allow your first fingers to be the drivers and they can carefully go in, same order, and you're gonna rub the surface of each tooth like an ice scraper rubs the glass, the window, okay? Every tooth gets cared for and you'll be surprised that you're still gonna scrape off more stuff with each of these levels of care. And we also understand that not every client allows all of it. Actually, I think they all eventually did allow everything, but it doesn't come on day one. It takes a while for them to allow each mode, okay? So then the finale of the care is we take a new piece of gauze, we dip it again in our solution, and we do a final wipe over. This wipe over is the purpose is to kill any residual germs on the teeth, and it's also to apply that good fluoride so that the decay that's happening in there, the teeth can be stronger and more resistant to decay. If they allow you to wipe their tongue, wipe their tongue. Okay, you just did it. Good job. He's cleaner and he's happy. All right, so move to the next slide. After we get their mouth nice and clean, then we're going to do the oral screening. So the oral screening involves a mirror and a flashlight. Our flashlight is also disinfected between each client, but then we just put it, just like the toothbrush, we put it into its own baggie. And so now this toothbrush has a little baggie and the light really helps. So we can do a thorough oral check of all the different structures inside the mouth. Your mirror or spoon can help to either pull the cheek away or push the tongue down or reflect the light up into surfaces that you need to see. You want to just make sure that the color is all even, that the teeth all look like they're of normal shape and size. I would really love it if you guys would go onto our website. We have videos of the oral screening, the things you might see and what would need to be reported to a dentist. Then also that we have another video of the tooth care so you can get all the tools again and how we do each thing. It's longer and it's more detailed. And then we also have videos about like oral diseases and oral versus systemic and how they're linked. So go there and you can get a lot more questions answered. But we can go to the next slide. All right, so here are two different oral care aids, and they are both doing oral screenings. So they have mirrors and flashlights, and they're doing a thorough look at all the surfaces and all the different tissues of the mouth. And you can go to the next slide, Laurel. So after they do their oral screening, if they find anything that looks off, we have report forms that have these teeth grafts on them, and they would circle the area that is of concern. And then they actually explain what they saw, like if it was broken tooth or maybe a hole in the tooth, or maybe they saw a patch of skin that was funny colored or funny textured, or there was a swelling, or maybe an area that sort of looks like a pimple, or it hurt when you touched a spot, the person seemed uncomfortable, whatever, we write it down. Oral care aides are not trained, they're not licensed, they are trained, but they're not trained to diagnose. Oral care aides do not diagnose disease. What they do is they will notify healthcare or family or guardians of areas of concern. And those areas can then be evaluated by a licensed dental professional, and they can decide whether or not it's something that needs care. Because they might not need care. That's not the oral care aide's job. Their job is just to make note of things that could be a problem. So that's the oral care report. We can turn the next. All right, so this is Jack again, the donkey, and my husband Mike and the mule, and we sometimes just are silly, and he's got a big plastic toothbrush there. And then this is Heidi, again, the oral care aide, and this is Francis, the one that we first saw with heavy buildup of plaque on his teeth, and this was Heidi cleaning everything off really well. Once we got everything really cleaned off, we were able to see that his gums were really red and inflamed, which were probably part of his pain. And then there was obvious holes in many teeth, which was decay, and he needed dental care, and he was absolutely hurting. The one thing that we have to say is that Francis was very high functioning. He was his Alzheimer's didn't take his ability to speak, and he was still living with his wife, and they were still doing a lot of things together. So he wasn't somebody that couldn't explain things. A lot of the people that we take care of, they don't have the capacity, even if they're able to speak, sometimes they can't put the words or make sense or explain what their problem is. So pain can go uncommunicated. So it's not fair to assume that because they haven't told you that their mouth hurts, that then it must be fine. It's probably, there's probably areas of discomfort. And the more discomfort that they get, the more problems you're going to start seeing. A lot of our people, I really believe that some of their care resistant behavior and their anger and their was because of the pain in their mouth. Because when we solved some of that, they behaved very differently. So anyway, that's where we're at. I'm trying to see if I got everything down here. Oh, I did want to note, in that picture with Francis, you can just see we have a little cart in the back right behind Heidi there. And this cart is something that we just use to drive through facilities, and it kind of keeps all of our supplies in that place, and so that we can care for lots of people, and we have our tools right with us all the time, and we're able to do quality infection control and get nice, fresh, new, clean stuff between every client that we see. So, that's what we are. You can go to the next slide, Laura. That's it. Okay. I thought I had one more that said questions. If I may, I'd like to just ask if anybody has questions, comments, anything at all. I would love to hear from you.
Yes, absolutely. Well, first, thank you so much for all of this information. This is why I've been excited about this, like I said, for a very long time. So I'm very happy that we had the opportunity to go through this. So we are getting some questions. So thank you all very much. But the first question that I have here is how can we help incorporate oral hygiene into someone's daily routine?
I'm really glad you asked that. What I've learned, now there's been actually many different programs that have been attempted that dental professionals go in, and I was one of them, that they go into care centers and they try to train care staff to provide this kind of care. I do know that nurses aides, nurses, probably medical providers all have oral health at as part of their training. And yet, I don't believe that it's extensive enough to adequately do this, but I also don't believe that they have the time to add one more thing. We went in and met some awesome people, and some of them even really made a very concerted effort to try to be thorough and do it like it was needed. And they just don't have the time. I mean, like, they're struggling just to get everybody dressed and get them to breakfast and get them to their next event. And
Sure.
their life is topped off. They've already got more than enough on their plate. So you need someone that's trained and focused, and they've been allowed the time to do just teeth. That's what's necessary. So when
Mhm.
you're saying how does it happen at your place, I apologize, but that's what I'm trying to do. I'm really trying. My heart's desire is to get oral care aides nationwide. We are creating systems of care, and our goal is to create a care initiative that can explode through the nation. And that is something I'm not sure how to make that happen yet. We've got the training, we've got the knowledge, we know how to implement an amazing program, but how to, multiply this out through the nation is something we're still working on. So if some of you have brilliant ideas, you'll have to get on the website and talk to me, because I would like to hear them.
Well, I think you're going to have some people reaching out to you. When you said that, we had someone comment, amen to that. So yes, thank you. So a lot of great questions. Someone had a question about dentures and any recommendations for someone who constantly wants to take them out, or they're complaining about denture discomfort.
Oh, yes, yes, yes. Okay, so that thing, oh, I'm so glad that came up. Okay, so dentures, they are not a one-time they fit, forever they fit. If somebody gains weight or loses weight, the denture doesn't fit very well anymore. So if that person has changed anatomically, it's likely that their denture literally doesn't fit anymore. That could be a problem. The other problem that's very common in this population is opportunistic organisms like fungus organisms can get on the denture, and because the dentures aren't cleaned adequately, it like thrush will happen, and they can actually, I had a person come into my office that literally all of the skin was gone from her palate. It was just bloody because of this kind of infection. So dentures can be very painful, even ones that fit beautifully, if the mouth, if these opportunistic organisms get out of control. And it's really hard to know that. I mean, if you look inside their mouth and their palate is bright red, that's what's happening. And so what you need to do is make sure that the denture is very, very clean, you know, put it in, clean it, and then put it like in Polident or something that disinfects, and then make sure their mouth gently, but it gets clean too. That might turn the scale. That might be enough. But if not, you might need to go to the dentist, and they'll probably get you on just an over-the-counter antifungal, and that could solve the problem, and they could be very comfortable. So it could be quite easy, and that doesn't take a lot of time to just make sure that things are clean. Yeah.
Mm-hmm. Yeah, that's very helpful. Someone else was asking about if someone is very resistant, they clamp their mouth shut. What would you do in that situation?
That was everybody at first, or almost everybody. Like I said, probably there's pain. And so it's all just about figuring out a way for them to feel like maybe give up the agenda for a minute. I mean, like, instead of being so intent on moving forward and what your agenda is, just let your mind change into the donkey mind. Try to think about them. Say, let's help them to feel heard and valued and cared and respected. So they are telling you that you're not respecting me. You're not listening to me. So listen, respect them. Let them believe that what they've got to say is real. And if they believe that you really do care, maybe not today, but probably tomorrow, you'll be able to get one more step. And often what we found is almost everybody, when you genuinely got into that place that you put your agenda aside and their agenda was more important, I'm pretty sure that every single one of them did allow us to do something. And so all we got done was the gauze and the antimicrobial solution just inside, and then we were grateful and appreciated. Adding that solution and the fluoride is a benefit. I mean, you want to get beyond that, but it will make a difference just by doing that. Do just that for several days, and when their gums don't hurt as much, they'll let you do a little more, and they'll let you do a little more. So be happy with every step. But the first step is they matter first, your agenda doesn't.
I think that's a great first step. Absolutely. We call that at AFA a lot when we do our professional trainings, person-centered care, and making sure that the person is at the forefront of all their care. However, I think I like donkey mind more, so I think we may be incorporating that a little bit more into our future trainings. But no, absolutely. I think that's really wonderful advice, and also being appreciative when you get to that first step, seeing every step forward as a win and as a success, and that is one step closer to healthier mouth, healthier person, and more of that joy that you were talking about. So absolutely. Someone asked, is it better to have a person rinse their mouth with water than have them do nothing if they are resistant? Is this perhaps something for someone to do?
Oh, sure. I mean, water is just great. I mean, rinsing is awesome. And people don't realize this. You've all heard that if you don't use it, you lose it. Well, people as they age, probably you and I too. I mean, if you think about it, if you aren't someone that knows how to swish, I mean, like power swish, you will actually lose the ability. Like, practice power swishing. I have people that as they age and I ask them to swish, and these are cognitively fine, healthy people, I just ask them to swish water while I'm caring for them in the dental office, and they can't do it. They'll do this tipping of the head to make the water run back and forth. So yes, keeping those muscles useful is smart. And then, yeah, rushing water between their teeth, absolutely, it's going to debulk that food out of there. It'll keep their oral awareness going. some of these people just become unaware of their mouth, and other people actually held stuff in their mouth as a protection against the pain. We found people that would hold spit in their mouth because their mouth hurt so much that it was the way to kind of insulate. Also, the person that had all the food that was packed in there, I believe that was partly because of insulating pain. So yeah, rinsing that out is awesome. And then the dehydration. So yes, 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 water's great.
Awesome. So we are getting a ton of questions. I'm really sorry, everyone, to all the questions that we cannot get to, but I'm going to be sending you all an email after this that is going to have Anita's website so you can check them out. Not only can you learn more about oral hygiene, oral health, you can also check out pictures of Jack the donkey and learn more, see more about him. But I really just want to thank you, Anita, again, so much. I wrote down something that you had that, the mouth is the mirror to health. And I thought that was just so valuable. And I was actually talking to one of my coworkers today about the importance of dental hygiene and how with dementia sometimes there's just so much going on that something as important as oral hygiene can be sometimes forgotten, or you have to put other things ahead of it, but that this is so valuable and that we have to pay attention to our mouths, that it is very important. So I'm so glad that you mentioned that. I'm so happy that you were able to do this, so thank you so much.
Use the contact button on the website. I would love to hear more questions because the more questions I get, the better we become. I really want to think of every angle, and you guys are the ones that are the experts with these people. And I would love, I really would love, please comment and talk to us. We want to learn, we want to get better. So thank you.
Absolutely. Well, thank you so much. Thank you, everyone, for attending and being so engaged today. I really appreciate it. But I look forward to seeing you all next month. Next month, we will be having another Care Connections on August 11th at 1 p.m. Eastern. And we're going to be having Stacy Simon of Stacy Simon Nutrition, who will be joining us talking about intuitive eating in older adults. So that's going to be a really exciting one. Stacy is very fun, so you're definitely not going to want to miss that one. So thank you all again so much for coming. Thank you, Anita. Thank you to Jack the donkey. Thank you all so much for attending, and I hope to see you all next time.
Thank you all.
Bye, everyone.